Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. We're pleased today to have Rita Wade, a registered nurse and the orthopedic patient navigator at Sentara Williamsburg Regional Medical Center with us. Thanks for joining us on the podcast today, Rita.
Thank you for the opportunity. I appreciate it.
Absolutely. Happy to have you. Before we talk about your professional experience in healthcare, I'd like to introduce the audience to you a little bit and just let them get to know you a little bit better. So if you would, please, just tell us a little bit about yourself, where you're from, your family, educational background, personal interests, things of that sort.
I'm originally from Clifton Forge, Virginia, out in the western part of the state. I've been in nursing for 47 years. I'm married. My husband is a retired pastor. I have two sons. One is an attorney in Tucson, and one is works for a communication system in Richmond as a project coordinator. I have 3 grandchildren, and I live in Williamsburg, Virginia.
You mentioned that your husband is a retired minister. What denomination, if I may ask?
Baptist.
My father's a Baptist minister, too.
There you go.
We already have something in common. Fantastic.
And now that he's retired, he volunteers up here in the Ortho Joint Center and works with me several times a week. So
fantastic, and we want to get into that, so thank you for that segue. Tell me, if you could, just a little bit about what someone who is an orthopedic patient navigator does for those who might be listening and unfamiliar with that role.
It's an exciting concept to me. Nursing is an art and a science, and to have a navigator, it's somebody who will start walking with you prior to your knee or hip replacement. They will do education with you, let you know what to expect, what's going to happen, what you need to do to get ready. We have a guidebook that has all kinds of information because we've learned the more educated you are, the more prepared you are, the better your experience. And then they have my number. I'm available after their surgery. So it's just a patient advocate who also works with the hospital team and physicians. It's a great opportunity, and I love it.
And you mentioned knee and hip replacement. For folks who are unfamiliar, that's actually a pretty commonplace procedure these days. And in hospitals, one of the sort of more frequent surgical procedures that we see. Is that correct?
It is. You know, with our lifestyles, and we're living longer than we used to, we're just wearing knees and hips out. And fortunately, technology has found a way to replace those and give us back our mobility and the things we enjoy doing. So I deal mostly with knee and hip replacement patients.
Okay. Now, I know from looking at a story that I actually saw on Sentara's website that your work in sort of helping people get back on their feet, you're actually involved in an interesting program. I think it's called a car transfer simulator.
Yes.
Can you talk a little bit about that and what the
Sure.
the origins of that is, and also sort
Sure.
of what the goal is?
We have a car transfer simulator. It is a large metal device it looks like a car. It has car seats just like our regular cars, the doors and all like that. What we do with it is when patients have had joint replacements or they've had a stroke or memory issues or brain injury, physical therapy will bring them into the gym, make the car simulator the height of the vehicle that they're going to be in when they leave here, and we practice getting in the car, getting out of the car, and it relieves a lot of stress. People think, how am I going to get in? How am I going to get out? Is it going to hurt? What help do I need? And this really relieves a lot of anxiety. I saw it, and I contacted our hospital auxiliary. They were generous enough to supply it for us, and we've been using it for several years.
And I imagine that for so many people, I mean, if we just think about our own lives, you know, our vehicle, our personal vehicle, really is so important to our mobility, to our freedom, to, you know, our sense of, you know, worth in some ways, just being able to get around and do things on our own. Is that something that you've also experienced in terms of helping people regain that confidence and that comfort because it is so important to their everyday lives?
Absolutely. And while they're here, they clearly aren't going to leave and be ready to drive, so we don't teach them how to do that. But how to get in and out of their vehicles so somebody else can drive them somewhere safely is a huge concern. You know, is it going to be painful? Is it going to be difficult? What is safe? What is not safe? And being able to adjust it to the height of their vehicle, then they can simulate exactly what they're going to need to do.
Now, you are a registered nurse, as we mentioned.
Yes.
In particular, if you would, as you sort of went through your training, what prompted you to get into healthcare as a profession, and then beyond that, specifically into the area of orthopedic rehabilitation?
Well, I thought about that this weekend because people have said, "How did you end up doing this?" And I've just said, "This is all I ever wanted to do was from a childhood is be a nurse." And I thought back, and I grew up in a multi-generational family. I had several aunts who were nurses. My grandmother was a hospital dietitian, and my grandfather was paraplegic. And I saw compassionate care demonstrated in the satisfaction I think my family members had. And I think that just sparked my interest. Orthopedics, I've done a lot of things in my career, but Sentara decided about 6 or 7 years ago that they wanted to have an orthopedic joint center, and it kind of ticked all of my boxes. I love patient education. I love individual care. So it was an opportunity for me to learn how to better educate patients, how to walk alongside them day by day. And, even though we say our goal is to decrease your pain and restore your function, functionally, that is very different from person to person. And so I enjoy that it's an art and a science. The technical skills are there. You have to constantly update, but you also need to be aware of the patient, their family, their surroundings that they live in, and their challenges. So I love the opportunity.
It sounds like you have a real passion for it, and that's great to hear. I wonder, in thinking about patients and obviously being respectful of patient confidentiality and privacy, you've probably seen countless patients over your career. I wonder if there are any particular stories that stick with you, any patient, whose interaction with you, resonates with you or is memorable to you to this day.
Well, I would tell you it's a general with the orthopedic patient care unit here. I have watched patients that have joint replacements. Frequently, they have had their other knee or hip replaced years before. They've come in now and had it done. Now that we have our early ambulation, we have group physical therapy where they do therapy an hour twice a day. We concentrate on their education and things like that. And almost to a person, my patients will tell me, when I went home after this knee replacement, I felt like I was 2 weeks ahead of where I was last time. So our progress helps them be more successful. It keeps them safe. It makes them successful more quickly. And I am passionate about that. I love seeing people be successful.
That's great to hear, and we appreciate your important role in helping people have that success as they go through rehabilitation and recovery. So thank you for all your great work, Rita, and thank you for taking the time to join us today.
All right. Thanks for the opportunity, and if you need a joint replacement, you know where you can come.
I will keep that in mind. Thank you, Rita.
You're welcome.
During this segment of the podcast, we like to share with our audience a healthcare story that we've either seen on TV or read in a newspaper or online, something that we found interesting and think that if you have a few moments to look up, it would be worth your while and something you might find interesting as well, particularly if you are interested in healthcare. So Erin is going to join us and share one such story. Erin?
Thanks, Julian. Sometimes we all think we've had a long day. Well, the day Ajibola Taiwo had earlier this year probably has yours beat. Taiwo, with the help of a 40-person team at VCU Health, delivered sextuplets. A native of Western Nigeria, Taiwo was 30 weeks and 2 days pregnant when she delivered 3 boys and 3 girls by C-section, the first ever sextuplet delivery at VCU Medical Center. The babies ranged in weight from 1 pound 10 ounces to 2 pounds 15 ounces, and all 6 babies were cared for in the NICU at the Children's Hospital of Richmond at VCU. Delivering sextuplets is a rarity. The CDC indicates that just 24 of nearly 4 million live births in 2015 were quintuplets or other higher-order births. Congratulations to the Taiwos on the delivery of their 6 little miracles, and hats off to the incredible medical team at VCU Health for literally delivering great care to the family. To find this story online, search for sextuplets in VCU Health.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VHHA, using the hashtag PatientsComeFirst. Thanks.